I'm now delighted to introduce our last session of the morning before the question and answer. And here we're going to shift tack in a way from the initial more theoretical and scientific presentations for the first time today to talk about how we can take this theory, the science and the policy that we've discussed already and implement this in practice in the everyday health system in all its complexity. And to do this, I'm delighted to introduce Sandy Bering and Catherine Aldred. In Greater Manchester, we have an amazing opportunity to pursue this kind of implementation and implementation science because of the devolved Greater Manchester Health and Social Care Partnership. And the promise of this devolved authority is to be able to create just these new kinds of health delivery systems that we've discussed in theory within a geographic area. And Sandy Bering is the executive director of the mental health and disability part of this devolved authority. And we're fortunate to have him here with us today, and that he's also been a tremendous advocate for the Greater Manchester Partnership at a national level, including for autism and services for autism. So Sandy's been very influential in that way, but he's also greatly facilitated and supported our collaborative efforts in Manchester to reshape the autism care pathway throughout Greater Manchester, and we're hugely grateful to him for this. I think Sandy has got some technical problems with his video, but we'll be able to hear his audio presentation just shortly. And Catherine, co-presenting with him, is a speech and language therapist who I'm delighted to have collaborated with now for over 20 years since we first worked together clinically. Catherine was the prime mover and developer of the PACT therapy that you've already heard a bit about and you will hear about more today, and which we've worked on together with other senior colleagues from around the UK over the last 20 years. She's an inspired clinician and has worked tirelessly to develop the training protocols that we've worked on, and particularly in the last few years, the international training in the method and the online delivery of PACT as well. So Sandy and Catherine are going to talk to us about the Greater Manchester Autism Intervention Project, the model, its aims, processes, and barriers. Thank you so much.
Okay, so hi everyone. Apologies for the technical difficulties that got in the way of me connecting with you via a video feed today. I promise you it's more than a bad hair day and hiding behind the sides and stuff. Anyhow, thank you for taking the time to join today's really important conference, especially at a time when we've all been facing a significant number of personal challenges and competing demands. I mean, I began working with families of people with autism and learning disabilities now more than 35 years ago, looking at the stress they experience and the different types of support that they said and they found particularly helpful. And I guess since that time, I've been trying as a clinician, service manager, commissioner and lobbyist to implement many of those things I learned then and subsequently, which really often are common sense, but far too often not common practice. Now, that actually was being the context for us also in Greater Manchester, and it was part of the rationale for us for establishing our health and social care devolution settlement for our population of nearly 3 million residents and patients. It's all about getting, I guess, more direct control over the resources and how we deploy them in a practical way that makes a difference for people. Clearly, carrying on as we'd done previously was not tenable to meet the poor health outcomes, life chances and viability of the system, even on a financial basis. And so we committed to making those changes. Now, at the very beginning, our devolution change commitment recognised that you need to listen to local service users and families in constructing true place-based solutions that make a real difference now and in the future. Recognising that we found a system under pressure in many ways, with many signs and symptoms saying things were wrong, significant gaps in provision, higher and higher eligibility criteria, service access thresholds, longer waiting times, and shortages in access to competent, capable and confident, skilled professionals able to implement effective evidence-based support, such as PACT and other interventions. As such, in Greater Manchester, from the very beginning, we agreed a set of priority outcomes. And one of the first, the priority one, was children having a good level of social and emotional growth, so they're ready for school. And that's all the more important for vulnerable children with autism and disabilities. Now, those principles that we've got there, I guess, set out what we believe is really important for all children. We think that it is possible to do more than we've done already. And in that sense, at the end there, early intervention and early childhood services that involve families and work with them are clearly more effective, and that's what the evidence says, than doing things to people. So I guess in that sense, we've been fortunate in that context that the national public declarations and systems have also been going with us. And I think sometimes one of the bits talked earlier on today was about how you connect this together. That's often my job, is being a system convener, being a boundary spanner, as it's called, pulling these bits together. Now, we've had public declarations from Future in Mind, the 5-year forward view, Transforming Care, the Green Paper, the NHS long-term plan, all of which prioritise better support for those with autism and learning disabilities, including reducing waiting times and practical support. And in GM, for us, if we move to the next slide, I guess we made that public commitment as well. So from our very early on fast track programme around Transforming Care, where we started from really the second worst state in the country, of the highest number of people in hospital, to currently where we stand, where we're not in the best, but we're now in this top second quartile of having made that progress and having moved things on. But we're still not there, and so for us, we have made recent commitments around our children's health and wellbeing framework, and also our autism and learning disability strategies, which you've got there, which basically say in front of you, really, we're committed to this. Because really what we found, if you move to the next slide, is in a sense, we need to match practical action with our words. And those actions mean that we've got to close off the fragmentation that's all too often our families tell us. We interviewed 500 families and talked to them about what their problems were. And in a sense, they said the same things. They said they want timely access to good evidence-based support. They want good services that match for their family circumstances and for their son or daughter, and working with us. They wanted us to think wider than just separating out what was going on in SEND or children's mental health or around youth justice or whatever. They wanted us to do that. They particularly wanted that practical help in terms of how to deal with sleep and behaviour issues there and smoother transitions. Now, that stuff is what we've been committed to in GM, I guess, and starting to do. And that change takes time. It takes effort to keep that going. Now, I guess moving on from there, if we keep going on the slides then, just in terms of just move through those. So in terms of what we've tried to do, and what I guess I've tried to do, is use our transformation funds in a flexible way, is saying, can I merge bits of that monies to begin making that journey? And for me, I guess I've been pinching bits of monies around Transforming Care, children's programmes, autism strategies, mental health programs, and access to national accelerator funds to try to do this work. And I guess that's where this funding for the element around PACT, or our investments around riding the rapids you heard about earlier on, more practical support to families, risk registers, has all come from. And I guess moving to almost the last slide from me before we get onto the important stuff, I guess, is the point of this is really important and really simple. It's trying to move from what's too often a really poor experience and a poor outcomes for families and individuals with autism, and that lead on a legacy many years into the future, into doing something that can be done differently. And in a sense, better access to PBS or PAC type programs and shifting to an early intervention approach clearly makes sense. It's clearly logical. Now, I guess Catherine will move on and provide the details of how we're trying to test that out and work that through.
Hi, everyone. This is Catherine Aldred. Thank you for joining us today, this really important day for us. Fundamentally, following a long period of collaborative research, what we're ultimately aiming to achieve is to reach the maximum number of children, maximum number of families, to make sure they benefit from the work that we've been doing to date. And we're giving an example of a robust evidence-based practice, which is PACT, where we've worked across the UK and with international teams rigorously over a long period of time. as we'll see from the next slide, that despite the nice guidelines for autism in the UK and internationally, what parents and families are telling us, and we see, is that the intervention is sparse or patchy. What intervention is available is largely unevidenced, and it's very difficult for families to access and often poorly coordinated. So our goal is a step change, and as many people have already spoken to us about, the challenge of generalisation. So the model is to start with generalisation instead of handing the child over to the experts, actually weaving in the intervention into the community, into the child's existing experiences. That includes the child's home, nursery, school context. And Pat works through empowering those adults who have prominent roles in the child's lives. And that's, of course, starting with parents, but also working with caregivers and teachers and teaching assistants, so that we can weave the best individually determined communication techniques and skills and embed them into the child's daily experiences and daily life. And Pat also is about giving the child a voice by fostering the best communication. So one parent said, communication is the key to knowing my child. So the Greater Manchester Project has been a fantastic opportunity to really test delivery. And what's important in our delivery is that we do have measurable outcomes, and we have inherent measures within the PAT model. So we know that video is already an effective way of measuring the progress that children are making and identifying their profile. So on video, we have the opportunity to look in great detail at the sorts of behaviours, the child's communication, their initiations and responses, and as well how the adult responds back and where there are other opportunities that we can build on. We've also developed a questionnaire called the Autism Family Experience Questionnaire, actually built on feedback from parents that engaged in our trials. And we've got also teacher questionnaires where they can report change they see, and parents questionnaires. So, for example, one parent said to us, it was just a complete revelation to me to watch the video. It illuminated moments that I'd previously missed. We've also, as you'll hear later on, got a survey where we can ask people about their values. We can ask parents and professionals about how the intervention and the evidence is achieving their goals. And for example, a professional said, PAT gives me a structured individual pathway to intervention, and we hope gives professionals that confidence that they're following evidence-based practice. So as we'll see on our next slide, we've developed a social enterprise, and this is the result of all our research. And this has a cascading model built really to get the maximum reach to as many children and families as possible. And the model has been by doing a training. For example, in Greater Manchester, we're training 5 trusts, and we have an initial practice phase where we reach 20 children. And then once we have 10 professionals certified and trained, we aim to reach 150 children through our 12-month pilot project. And then through their experience, we aim to have local leads who then can take on board a leadership role, training role, so that they, in that local service provision, can extend to 300 children and beyond. We want to extend training and service delivery in localities in this way. So our aim is really to have a long-term impact on changing lives, and for example, some of the long-term outcomes that are already in our research publications, but equally we're aiming to prevent some of those emotional behavioural difficulties that we see by intervening at the earliest opportunity when there are first concerns. And we want to change the quality of life, not just for the children, but also for the whole family. And we do this by trying to bring about the optimal fit, something where we get a better alignment and adjustment to understand the individual better, and that adaptation around that individual that's supportive to give them the best support. And in this way, we're hoping, where possible, to prevent the sort of crisis management that we see necessary for some children. And one adult said, this is from a parent, said, "PACT is a mindset. I carry it with me in daily life." So in our project, we're aiming for each professional to have a direct caseload, deliver 12 PACT sessions. Professionals can see between 4 and 5 cases per day. Actually, this is becoming more efficient through our online methods. And trusts each have initially a team of 2 professionals that can work together to reach 150 children. And we'll see also in the next slide that PACT mirrors the definitions and terminology and skills outlined on the ADOS 2. And it's aligned to the ADOS 2 and the Early Social Communication Battery published by Hographer. And PACT will be of interest to speech and language therapists, psychologists, psychiatrists, specialist teachers, and specialist social workers or therapists dealing with children on the autistic spectrum. When we look at some of the barriers we experienced from our implementation in the GM project, so we hear from service managers that they have competing priorities and lots of demands on services. And we know that this is particularly their diagnostic services, but equally there are demands on setting up secure online IT systems for teleconference, and the challenge, of course, during lockdown in COVID-19. But positively, we've been able to work with them in partnership and finding solutions. So first solution was we very much appreciate the financial support from the GM commissioners, funding the PACT training itself and funding the backfill for releasing staff to 1 day a week during the 12-month project. We're working towards embed PACT into existing service structures, which is particularly an advantage to trusts. For example, during this period of lockdown, some trusts have had to postpone some of their diagnostic services, but have been able to use some online therapy, teletherapy, and deliver intervention. And if we can weave in measures into that intervention, then we have a very clear picture and understanding of the individual child at the same time as delivering intervention. And we've helped those services find a solution to their IT difficulties. In fact, PACT is very compatible with IT solutions because it's already using video. And we also have the advantage of triangulating together the child needs and empowering parents to a position of confident understanding that makes sense to them. So the benefits are to drive change and the opportunity to truly embed intervention into daily lives 24/7 and have the maximum impact. And we believe, this is at modest cost compared with some of the other interventions. We can maximize the advantage of online solutions. We hope this is making it accessible to families from the comfort of their own homes using video. And we can work with families and help them achieve a better understanding and adjustment. And this may be a better preparation for those children that require a diagnosis. We know that we want PACT to be about transforming skills so that adults feel confident and competent, they feel valued, they have valuable roles in these children's lives, and to have a long-term impact. And we want to enhance professional self-worth and value by increasing their confidence in using structured, rigorously tested evidence-based practice, so that they feel they have clear structured protocols on which they can base their intervention. Thank you.